characteristics of female, which is similar, different from male. And so this is the internal female sex organs. So this is the uterus, the strongest muscle daw siya, no, of the human body or the female body. This is the ovary. No? This is where the egg cell, no, is produced, and this is a fallopian tube, wherein matured egg cells passes through, no? And down to the uterus, then meets with, diba, on a lower level ng cervix. Dito siya, and once, yes po, yes po,
Ma'am, nagpe-present po kayo?
I forget, sorry.
Ay pa.
Okay, so as I was saying, this is the internal female sex organ. So we have the uterus, the strongest muscle of the female body. Of course, wala namang uterus ang lalaki. Diba nga? And kahit na tumambling sila ng 10 beses sa earth or 1,000 beses sa earth, walang matrace ang lalaki. So they won't be able to reproduce only by helping in the reproduction process. So uterus, no, is yung bahay bata, matriz na tinatawag. Ovary is where our egg cells, for the female students, this is where the egg cell comes from, develop and comes from. No? And then, once matured, dito siya dadaan sa fallopian tube, and then enters the uterus. If there is sexual intercourse, kung may mangyayaring union with the sperm cell, ay magkakaroon po, may possibility po na magkaroon ng offspring o yung formation of the embryo up to becoming a baby. No? How? So ito po si cervix. Ito po yung pinaka-bottom line ng uterus and connecting with the vagina. So, you know, for a fact, maybe you are aware that in sexual intercourse, vagina is part of the organ that actually being used during the sexual intercourse with male. And this is where the penis enters, no? So, dito po din lalabas. Pag lumabas na nagkaroon na po ng ejaculation and expulsion, yung male, ay dito po yun papasok sa vagina, no, entering, and dito din po sa uterus mag-meet. No? Kaya dito rin po magpo-form yung baby, no? From embryo to fetus to becoming a full child or baby. The vagina is a fibromuscular made of fibrous and muscular tissue canal leading from the outside of the body to the cervix of the uterus or womb. It is also referred to as the birth canal in the context of pregnancy. Dito rin kasi lumalabas yung baby, no? The vagina accommodates the male penis during sexual intercourse. Semen containing spermatozoa is ejaculated from the male orgasm into vagina, potentially enabling fertilization of the egg cell or the ovum to take place. So cervix is the next of the uterus, the lower narrow portion where it joins with the upper part of the vagina. It is cylindrical or conical in shape and protrudes through the upper anterior vaginal wall. Approximately half its length is visible. Ayun, sinasabi nila, ano nga yun? Nakita ko na yung matris mo. Parang ganyan. May nagbibiruan minsan. Pag tumatawa ka, kitang-kita na yung matris mo. Ganyan. No? Dun sa bibig, parang siyang similar, no? Doon sa cervix. The remainder lies above the vagina beyond view. The remainder, hindi po kita yung mismong uterus, yung loob ng uterus. It takes a machine, yung tinatawag na transvaginal, yung parang microscope na ine-enter siya. It is shaped like parang penis ang itsura niya, pinapasok siya sa vagina para makita po kung ano ang appearance ng matriz. No? I know because I've been there. I experienced that. The vagina has a thick layer outside, and it is the opening where the fetus emerges during delivery. The uterus or womb is a major female reproductive organ, the strongest muscle in the female body. A pear-shaped muscular organ, its major function is to accept fertilized ovum, which becomes implanted into endometrium, and derives nourishment from blood vessels which develop exclusively for its purpose. So dito po sa lining, no? Dito po sa lining na ito, meron siyang parang balloon, no? Parang balloon na pag once pumasok doon ah, yung fertilized ovum, no? Dito na rin siya kakain, dun sa loob ng kanyang parang balloon, dun sa matriz. May tubig siya, na kung saan palutang-lutang siya doon. No? Para siyang may plastic na nababalutan ng may tubig. So, doon na siya kumakain, no? Connecting. I know again because my first pregnancy was a failure, so I had miscarriage. I was diagnosed with enlarged uterus. So parang yung lining ng uterus ko ay kumapal, pero wala pong baby. Ba't kayo nag-aalisan? Ayaw niyo ba ng discussion? Left the meeting. Of course, the secretary will check the attendance. It's already 1:35. Okay? So, I know because I experienced po nga yung ganyan. Yun, parang ilang weeks, 2 weeks akong delayed. Kasi supposed to be 13, April 13 ay meron na ako. Kaya lang, 29, ako ay naraspa. Kumbaga. Kasi, yun, nung nakita, meron siyang lining, thickening of the wall of ng uterus. Pero there was no ovum, walang baby. So, in order for me to be, para maproteksyonan at maiwasan ang infection, kasi infection sa matriz, nakakamatay yun. So, kailangan kong mag-undergo ng, anong tawag doon? Raspa. Hindi na tawag nilang raspa sa Tagalog. Ayan. Tapos, medyo natagalan bago ako na buntis ulit. And then, this my eldest. Si Christian na yun. I thought nga, may lahi kasi kaming baog. Kaya, ako nervyos. Ang una. Okay, so it derives nourishment, no? The ovum derives nourishment from blood vessels which develop exclusively for this purpose. So kung hindi ka buntis, there's no reason for the lining of your uterus to be thickened. Because the thickening of your uterus is manifestation that um, there is a fertilized ovum inside it. No? And then it becomes an embryo, and then fetus, and stays until childbirth. If the egg does not embed in the wall of the uterus, female begins menstruation. Kaya niloloko ko yung mga anak ko, and lolokohin ko kayo. No? Kayo ay isang regla na hindi natuloy. So, supposed to be kayo ay magiging regla. Kaya lamang nagkaroon ng union si Papa at si Mama, yung kanilang yung sperm cell at saka egg cell na buo. So, yung regla ay hindi natuloy. Kaya sabi ko, huwag kayong maarte, regla lang kayo. Niloloko ko yung mga anak ko. Reglang hindi natuloy. So, supposed to be, so if there was no development or union, ay menstruation yung magiging resulta. Dahil nagkaroon ng union, hindi natuloy si menstruation. Gets nyo? Would you consider that uh, joke as true?
Yes po, ma'am.
Scientifically, yes. O, di ba? Kayo ay reglang hindi natuloy. Kasi ang explanation dito ay nagkaroon ng union, nagkaroon ng development. So, there was a union between the egg cell and the sperm cell. So, a baby resulted. Kung wala pong union ng sperm cell tsaka ng egg cell, you could have been a regla. Natuloy kayo. So, yun. Tatapon na lang kayo. Mapupunta kayo sa napkin, tapos i-dispose kayo. So, hindi kayo natuloy to become a regla. But you are a baby. Ito yun ha. Oh, that statement is that. Binaliktad ko lang. If the egg does not embedded, you were embedded. Oh. If did not embed in the wall of the uterus, a female begins to menstruate. Fallopian tube. Of course, you know fallopian tube, di ba? What is fallopian tube? Ayan. No? Tunnel. Di ba? Nakadikit doon si ovary. Kasi pag ripened na siya, pag matured na siya, tuloy siya doon sa fallopian tube. Diba? So there are two sources. So tanggalin man yung isa dyan, itong ovary yung isa, mawala man, meron pa din. No? Meron kasi mga cases na tinatanggal din. Minsan ito rin ang tinatanggal. Itong uterus. Hay! Ba't tinatanggal po? There are abnormalities. Mahal yun. Okay, the two tubes leading from the ovaries into the uterus and maturity of the ovum, the follicle, and the ovaries wall rupture, allowing the ovum to escape and enter the fallopian tube. There it travels towards the uterus, pushed along by movements on cilia on the inner lining of the tube. This trip takes hours or days. If the ovum is fertilized while in the fallopian tube, then it may normally implant in the endometrium when it reaches the uterus, which signals the beginning of a pregnancy. So, pag nag-stay po yun, halimbawa, yung union ay doon nasa lubong ni sperm sa fallopian tube, delikado po yun. Hmm? It may rupture, yung size kasi ng ovum will be enlarged at hindi siya tumuloy doon sa pinakamatres. Sasabog po si fallopian tube. Ectopic pregnancy ang tawag doon. At pwedeng ikamatay nung tao, nung babae kapag na-infect. So, kailangan nature na tumuloy yung ovum o yung fertilized egg. It becomes fertilized egg cell. Fertilized siya kapag may union na with the sperm cell. Ngayon, itong union na yon dapat nangyari sa loob mismo ng um, uterus. Pag nangyari yon outside of the uterus, lalo na kung sa fallopian tube, kasi na-delay yung flow ni egg cell, sinalubong siya doon ni sperm cell, doon na siya nabuo. So doon nangyayari yung tinatawag na ectopic pregnancy and that is dangerous. Can be a cause of death on the part of women. So pagka ganun, instead na ituloy ang pregnancy, ay tinutunaw na lamang yung baby in order to, the ovum, no? Hindi pa naman siya pinaka-baby. Tinutunaw na lamang kung hindi siya bumababa, tutunawin na lang yun para si mommy ay masave. The complication of women. Ovaries. The ovaries are small, paired organs located near the lateral walls of the pelvic cavity. These organs are responsible for the production of the egg cells, ova, and the secretion of hormones. The process by which the egg cell ovum is released is called ovulation. The speed of ovulation is periodic and it impacts directly to the length of a menstrual cycle. So the regular days of menstrual cycle is, what do you know? 28. Tama po ba? Ano ba yun? Yes. 28. Yes, 28. The regular menstrual cycle. Okay, tapos the external female organ, so this is it. The vulva, the mons veneris, the labia majora, yan, meron namang label. Ba't ba kailangan alamin? The prepuce, clitoral hood, the first skin above and covering of clitoris. Ito yun, no? Walang nakalagay na pangalan, ano, hindi siya, ano. So, dito yun, yung pinakataas, yung prepuce, yung parang pinaka makapal na bahagi ng, ano, yung, di ba sa clitoris, kung nakikita nyo girls, okay lang naman na bulat-latin ninyo yan para naman maging aware kayo, no? Yung vagina, yung pinakaloob, this is the external portion of the vagina. And then the clitoris is the most sensitive, no? The most sensitive area. Kaya kailangan yung malaman yan for your own protection also. I would use that as a protection, clitoris. No? Kasi halimbawa, may rape, may attempt of rape, kung marunong umaalam yung lalaki, the victim becomes a willing victim kapag naispatan kayo doon sa pinaka-weakest or most sensitive area ng inyong katawan, na kahit hindi na kayo persahin, kayo ay unti-unting manghihina dahil ginagamit niya yung kanyang kaalaman sa weaknesses ng bahagi ng inyong reproductive organ. Or even your breast, yung nipple, no? So maybe kapag nasasagi iyan, you become sensitive or ano, napapansin ninyo, it also weakens your protection and defense during attack. So the worst scenario, bibigay kayo kasi na-weakened na kayo. And usually, ini-stimulate ng rapist yung kanyang victim to create that sensation. So it pays for you to be knowledgeable na hindi nyo pahahawakan ang areang yan sa kahit sino kung ayaw nyo at hindi nyo asawa. Hindi nyo yan pahahawakan. But dahil it can lead to loss of your senses. So, we're teaching you this. This is also empowerment on your part na hindi kayo basta bibigay, no? Sa panunukso o yung pagsiseduce ng kung sino man sa inyo nang hindi kayo handa, kahit gusto nyo pa, pag hindi kayo handa. Kaya nga may tinatawag na statutory rape dahil posibleng yung bata ay nasarapan. Palagay na natin, nagkaroon ng pleasure on the part of the boy or the girl din. Kaya hinahayaan na lamang niya na gawin sa kanya iyon, paulit-ulit, no? So inaabuso. Pero at the back of the mind, kung may nagturo sa kanya, parang may mali dito. Lalo na kung incest o kamag-anak o kaibigan. Parang sinasamantala. Maraming cases na ganito. Kayo, bilang matured ng mga tao, dapat yung maintindihan na kapag hindi kayo willing, no? Pag below, pag binor de edad, no? Kahit pa willing kayo, sinabi, hindi yan rape. Kasi girlfriend ko yan, ginusto rin niya. 16 years old. Ibig sabihin, mentally speaking, hindi pa alam nung tao yung kanyang nararanasan, hindi pa niya naiintindihan kung ano ang magiging consequences nito. Kaya kung sino man ang lalabag doon sa batas ng statutory rape, ay may pananagutan sa batas. Knowing this particular aspect na this is clitoris is the most sensitive. Siya daw yung counterpart ng penis kasi tumitigas once stimulated. And once stimulated, nagsisecrete yan ng hormones. Hormones. Kasi sinasabi ko sa inyo itong pag-aaral na ito, hormones. Even yung pagkakapanganak sa inyo, even yung sex drive na nararamdaman ng tao, ng magulang, that is all about hormones. No? Secretion of hormones. So, yun. Kaya, kailangan maintindihan. Hindi ba, pagka halimbawa, in-stimulate yan, there will be hormones that will be excreted, lalabas, no? Dito sa ating vagina. So, clitoris, the glans or the head, shaft, and crura, root. The clitoris is particularly sensitive to stimulation. This is a gland that is highly sensitive and is made out of erectile tissue that can become erect during arousal. So labia minora, the inner lips, and of course, all of this, no? Yung minora, tsaka majora, parang protection siya. No? So inner lips surrounding the vesicle where sweat and oil glands, extensive blood vessels, and nerve endings are located. So minsan, sasabihin na iba ang amoy, ganun, no? Iba ang amoy, kasi talaga namang pinapawisan din po yung area na yon. So we have to be very, very clean, no? The regular cleaning of that particular area ng ating body. Vestibule area surrounding the urethral opening and vagina, which is highly sensitive with extensive blood vessels and nerve endings. Urethral opening, end of the tube connecting to bladder and used for urination. Ito po. Okay. Yung labasan po ng ihi ay iba po sa labasan ng baby. Dito lumalabas yung baby. Yan eh. Pag halimbawa na-stimulus kayo, yung na-arouse kayo, so hindi po dyan sa urethral opening kasi ihi lang po yung lumalabas dyan. No? Dito po lumalabas yung parang fluid, usually dito sa may baba mo yan makikita kasi nakalabas na siya. And then stages of puberty, so menstrual cycle, as you, di ba alam niyo naman na itong mga girls, ano eh, kapag kayo ay 11 to 15 years old, ito daw po yung age na kung saan kayo na po ay magkakaroon ng stage of puberty, and menstruation is one of the manifestation, no? Having a menstruation or menstrual cycle. So if you can remember, how did you feel? Kasi I can still remember how during my first few days na minsan may nakikita kang stain sa underwear bago ka pa magkaroon. So that is alien on your part. Tama? Diba? Kung hindi ka naman sanay na merong lumalabas na parang sipon, yung white blood cells. So kaya naman ay yung malapit na magkaroon, naaalala nyo ba? Merong parang brown na itinatapon yung inyong vagina. Tama ba, girls? Hindi? Wala kayong ganon? Tapos yung enlargement of the breast, the shape of your body and your hips, dala po iyan ng estrogen. Kaya kulang sa balakang. Kulang sa estrogen. Yung maraming buhok, maraming androgen. Yan. Yung mga ganun. So hormones. Everything is about hormones. Okay, so monarchy is a female's first menstrual cycle marked by her first episode of menstrual bleeding. Monarchy occurs during puberty, preceded by breast growth, axillary and pubic hair growth, and growth spurt. Menstruation pertains to sloughing of the uterine lining if conception has not occurred. It may last within 2 to 6 days. O ilang kayo? O 3 to 4. Regular ko yun. 3 to 4. Kung na-prevent, di ba napiprevent, yun na nagkakos ng migraine. Yung, ewan ko kung ano, bumabalik. Sabi nila, no, study shows that mayroong mga nagbebenta ng napkin na kaya daw nagkakaroon ng migraine yung mga babae dahil yung flow daw ng blood coming from the napkin, the feminine sanitary napkin that we are using is hindi ka nagpapalit ng madalas. Saka yung prevention of the flow going back daw is yun daw yung nagkukos. Ano ba? Going back? Di ba labas lang yun ng labas? Ganun. Minsan sa pagkain o kaya activity, nape-prevent din ang pag-flow if you were able to see that or observe that in yourself. Okay, so it involves the changes in the endometrium in response to the fluctuating blood vessels of ovarian hormones. These are 3 phases as described in the figure. So luteal phase, follicular phase. Yan, dalawa. The first 14 days is called follicular phase, and the 14 to 28 is luteal phase. No? Ito po yung possible, yung 14 no, before 21, mula 14 before 21. Ito na po yung ovulation or ito na po yung time na kung saan ay napo-fertilize si ovum. No? Okay. So, first day of menstruation is usually the first day din ng cycle. Okay? Flow, tapos biglang meron ka na naman ulit na secretion and the process starts again. Okay? Okay, so I'll show you a video where it describes illustration of follicular phase, menstrual phase, or rather menstrual phase, follicular phase, ovulation phase, luteal phase, and back again. Problems associated with menstruation include premenstrual syndrome, the PMS. Sino meron nito? Diba? 80 to 95 daw. Meron. Dysmenorrhea, painful menstruation caused by overproduction of prostaglandins, causing the uterine muscles to contract, and amenorrhea, disruption or absence of menstruation. All of this involve the fluctuation of hormone levels associated with menstruation. At menopause, usually around age 45 to 50, o diba? A woman stops menstruation as an ova, as ova are no longer brought to maturity. During the 3 to 4 year, this transition women may experience hot flushes, night sweats, sleep disturbances, resulting in fatigue, irritability, short-term memory loss, difficult concentration, headaches, anxiety, depression, and difficulty of becoming sexually aroused. Okay? So, female characteristics during puberty, widening of hips and pelvis accommodates giving birth, but also results in downward shift in center of gravity. So, yun nga, everything is a nature. Since tayo ang yung mga nganak, kailangan i-prepare yung body natin bago pa tayo magbuntis at manganak. So, halimbawa, hindi pa naman talaga matured yung tao, o yung baby, o yung dalaga, no? Eh, wag muna, di ba? Pero noon kasi, sa ibang culture, 13, 14, 15, they are already engaging into sexual intercourse, ibang mga kultura iyon, or even in the Philippines, na merong mga maaga na nag-enter sa ganun. Yun, kung bakit piniprevent. Kasi hindi pa ready yung body for its purpose na manganak. No? So ako nga, nag-asawa, magti-20. Ako naman, hindi talaga siya normal. Kasi over, di ba? Overproduction ng mens. So, unang-una, bakit may over? Anything na sobra, mali. Kakahilo, di ba? Yung excessive na blood releases, and even yung contraction ng ating puson, no? Masakit, no? So, pero ako hindi kasi, naranasan ko lang siya na yung kakaedad na, yung parang nagkakaedad na, parang manifestation na rin yun ng menopausal stage. Pero nung dalaga pa ako, walang pagbabago yung energy level ko. Wala po akong dysmenorrhea kasi magalaw akong tao. Parang yung activity ko is helping me to be stronger. So, I only have 3 to 4 days na pag may mens. Yung iba, nakikita ko na dati, pati prof ko noon, 37 na siya. Namumutla siya, sobrang putla niya. Hindi kasi siya nag-anak. Grabe, ayoko yung maranasan. Kitang-kita ko siya yung parang very, siya eh, energetic, ganyan. Pero pag meron siya, talagang putlang-putla yung itsura niya, para siyang ghost. Tapos, hindi siya makagalaw, nakaupo lang siya, tapos meron siyang pang dito sa headache, yung cool, parang sa cool fever yung noon. Sa ice bag ba yun, ganyan. Tapos, tatawagin niya ako sa faculty room. bawal ang estudyante sa faculty room. Daw pumapasok. Sasabihin ng mga teachers, halika, pumasok ka. Hindi ano makakalapit sa'yo. Eh di, bawal pumasok sa faculty room. So, yun, kung lalapit naman ako, sabihin niya sa akin, ito, puntahan mo tong section nito, ibigay mo yung prelim, ganun lang. Gagawin ko naman siya. Iniwan na ako ng mga kaibigan ko. Thank you sa ano, thank you sa assignment of, dysmenorrhea niya. Pumapasok na ako ng classroom bilang substitute teacher, assistant of the professor, kahit na third year college pa lang ako. So, yun siguro. Kasi, ayun, ka-boardmate ko pala yung hawak niya. Ang sungit ko daw. Kasi exam eh. So, widening of hips, it takes some time before mahinog ng maigi yung pelvic nyo tsaka yung hips natin, no? So, ako, muntik nang masisaryan yung first baby ko. Kasi sobrang laki ni Christian, haba niya. No? Sabi ko, ang late daw ng sipit-sipitan ko. Yun. So, maliit akong babae, malaki yung anak ko. Natural, maliit yung sipit-sipitan na tinatawag or pelvic bone. Okay? So, enlargement of breast and puberty, both the glandular and fatty tissue of the breast develop considerably. Differences in breast size between women are primarily due to differences in the amount of fatty tissue. It is also not uncommon for one of a woman's breast to be slightly larger than the other because of gravity, and sometimes kung ano yung madalas nating area yung madalas natin gamitin, kaliwete ka or kanan ka. So, minsan, ang kanan mo, kung ano ba tawag doon, right-handed ka, makita mo mas firmer yung breast mo dito sa right. Ano ibig sabihin ng mas firm? Usually maliit kasi dito sa kabilang side, maliit kasi yung fatty tissue, yung excess fat is avoided if you keep on, di ba, parang moving it. Eh yung isa na hindi mo masyadong nagagalaw, it allows the fatty tissue to be enlarged or mas lumaki siya, ganon. So, check yourself whether your left breast is larger than your right breast. So since kayo naman ay mga dalaga pa, hindi pa naman kayo nagpa-breastfeed, kaya makikita niyo yun, totoo yun. So lalo siyang mas magma-manifest kapag may edad ka na and then gravity takes place, makikita mo na yung right area mo, since you're a right-handed, is firmer and smaller. Yung left side ng breast mo naman is mas malaki, no? Kasi lagi siyang nakarest. So, kasama dun sa laki yung konting taba. Sa part ko, konting taba. Ayun. Gets nyo na. And also gravity. So, hindi po nakakapagtaka kung sakali man na mas malaki yung kaliwang dede. No? I researched for this particular 15-minute YouTube. And then you will be amazed, panoorin lang ninyo, hindi nyo kailangan magkabisa, panoorin lang ninyo para maintindihan yung luteal and follicular stage of menstruation. Bakit nyo kailangan intindihin ito? Kasi again, yung sinasabi ko sa inyo, hormonal, everything is about hormonal. Even kayo ay produkto ng hormones, even tayo ay produkto ng hormones, no? So, alam natin yung parts. We do have the parts, female. No? Alam natin yon. Yung mga function, so somehow, naiintindihan natin. Tama? Yung uterus, ovary, fallopian, vagina, no? Yung cycle ng pregnancy, naiintindihan na rin natin kahit papaano. Na nanggaling sa ovary, dadaan sa fallopian tube, kapag nag-mature niya, nasa lubong siya ni sperm cell, may possibility of fertilization. And union becomes an ova or ovum, and becomes an embryo, and becomes a fetus, and becomes a full-blown child. No? So, alam natin yung cycle na yun. Pero yun po kasi menstruation is very important in determining productive ability And at the same time, moods, determining some moods. Yan, diba may regla yan eh. Hindi, parang galit, may regla ka? Ganun. Diba ganun, yung mga common expression? Ay, ano ba yun? Ganun na ugali yun. Baka nire-regla. Oh, ganun yung common term. Regla ba talaga yung cause ng minsan mood swings or hormones? So, let's watch this 15 minutes and after this, you're free to go. Hindi pa ako mahigpit sa gas.
Armando Suringan, Biology and Medicine videos. Please make sure to subscribe, join the forum and group for the latest videos. Please visit Facebook Armando Suringan. In this video, we will look at the hormonal regulation of the female reproductive cycle. So we will be looking at the menstrual cycle basically, and yes, so the menstrual cycle. The hormones of the female is so much more complicated than the males, but hopefully we'll be able to understand it by the end of this video. So we begin with the hypothalamus and the pituitary glands, which are made up of the anterior and posterior pituitary glands. We'll be focusing on the anterior pituitary gland. The hypothalamus regulates hormones released by the anterior pituitary to the portal blood here. In the female reproductive system, the hypothalamus produces a hormone called gonadotropin-releasing hormone, which will travel here to the anterior pituitary via the portal blood. And it will cause the cells in the anterior pituitary gland to produce two important hormones, known as FSH, follicle stimulating hormone, and LH, luteinizing hormone. Please note that in males, this same process also occurs. Males also produce gonadotropin-releasing hormone, which will cause the anterior pituitary to release luteinizing hormone and follicle stimulating hormone. So, what will these hormones do in the female body? Well, these hormones will travel to the female ovaries, where the female eggs are produced. So let's just recap quickly what the ovary is and where it is. So here we have the uterus and the ovaries, which connects to the uterus via the fallopian tube, but it's now known as a uterine tube. So we will focus on this ovary here. So let's zoom in. So here is the ovary, and it has blood vessels. And it's through these capillaries, these blood vessels, that the hormones can enter. Now, in each ovary, there are follicles. Women have many, many follicles in the ovary, and each month, only some will begin to mature, but only one will ovulate and become, essentially, will ovulate and produce an egg. Now let's just say it's the beginning of the menstrual cycle. So just after a female has shed her uterine wall, just has a period. Now within the ovaries, females have many, many, many primordial follicles. And each month, only some of these primordial follicles will mature into primary follicles, and they will keep maturing, but only one will ovulate. So here, I'm drawing one primary follicle, and it's the beginning of the menstrual cycle. Before we continue on, let's look at the changes of the hormone concentrations that come from the brain by looking at a graph. So here we have a y-axis which shows the concentration of the hormones in blood, and on the x-axis is the duration of female menstrual cycle, which normally goes for about 28 days. So the dotted line in the middle is 14 days, which is halfway. Now, just to simplify things even more, the menstrual cycle can be divided into two phases. The first 14 days is known as the follicular phase, and the last 14 days is known as the luteal phase. And this is important to keep in mind. So the first is the follicular phase, the second is luteal phase. Now, initially, in the beginning of the menstrual cycle, there is an increase in gonadotropin-releasing hormone secreted by the hypothalamus because it's the start of the menstrual cycle. And this should cause a steady increase in follicle-stimulating hormone and luteinizing hormone. But instead, we see an increase and then a slow dropping level of follicle-stimulating hormone, and we have a steady level of luteinizing hormone. Why is this? Well, the reason is actually quite complicated, but just hold on to that thought and hopefully it will make sense. So let's go back to the ovary. So follicle-stimulating hormone will initially rise, remember, because the follicular phase is the first phase of the menstrual cycle. Follicle-stimulating hormone will enter the ovaries, and what they will essentially do is stimulate. It will stimulate follicle maturation of these primary follicles. And so some of these primary follicles will mature into a secondary follicle. I'm only drawing one secondary follicle for simplicity. While these follicles are maturing, they produce another hormone called estrogen. Now, estrogen has many effects. In the first 10 days of the menstrual cycle, so in the beginning, estrogen has a negative feedback on the pituitary gland, inhibiting the release of luteinizing hormone. To put it simply, at low concentrations, estrogen inhibits luteinizing hormone secretion from the anterior pituitary. And that is why we only see a steady level of luteinizing hormone in blood. Because even though gonadotropin releasing hormone from the hypothalamus is stimulating the release of luteinizing hormone, at low concentrations, estrogen will inhibit luteinizing hormone release. Another fact is that follicle-stimulating hormone is secreted primarily in response to low estrogen concentrations. So when estrogen levels rise, follicle-stimulating hormone levels will fall. And that is why we see in the graph a steady drop in follicle-stimulating hormone, because there's an increase in estrogen levels in follicles. So let's draw another graph and see the concentrations of the hormones produced by the ovaries during the menstrual cycle, which goes on for 28 days. So as the follicle matures, they will produce more estrogen, which, as I mentioned, at low concentrations, estrogen will inhibit the secretion of luteinizing hormone, and also the increase in estrogen concentrations will cause a decrease in follicle-stimulating hormone secretion. Estrogen is an important hormone, especially for females, because estrogen is basically male's equivalent of testosterone. Estrogen peripheral effects include it stimulating bone and muscle growth, it stimulates endometrial growth, maintains female secondary characteristics, and maintains the gland, the breast, amongst many other things. So just to draw this graph up to 10 days of the menstrual cycle, we see a steady low concentration of luteinizing hormone due to the inhibitory effects of estrogen, remember, in the first 10 days. And we also see a steady drop of follicle-stimulating hormone due to the increase in estrogen levels as well, which has a negative feedback. So what happens after 10 days? Well, after 10 days, estrogen levels will continue to rise as the follicles mature in the ovaries. And after 10 days, as estrogen levels rise, it will have a positive feedback, and it will stimulate the release of luteinizing hormone. So at low concentrations, estrogen will inhibit luteinizing hormone secretion. However, at high concentrations, estrogen will stimulate luteinizing hormone secretion. Now, things are changing. The increase in gonadotropin releasing hormone and estrogen will stimulate then luteinizing hormone secretion. And you see this massive spike in luteinizing hormone concentration. It's this massive luteinizing hormone concentration that will trigger ovulation of the most mature follicle in the ovary. The ovulation of the follicle will release what we know as the female egg, oocyte or oocyte. After ovulation, the luteinizing hormone levels will drop back down. Gonadotropin releasing hormone will slowly drop as well. Follicle stimulating hormone also had a small spike as a side effect of the surge of luteinizing hormone release. So, luteinizing hormone triggers ovulation. An oocyte is released. After the follicle ovulates, the follicle will turn into a corpus luteum, which is a dead follicle basically. Now, that is why the first 14 days of the menstrual cycle is called the follicular phase, because it all has to do with the follicles and its maturation. And the last 14 days is known as the luteal phase because we have the formation of the corpus luteum. The corpus luteum will essentially slowly degrade. However, it also has a purpose in that it secretes hormones. It secretes three hormones: estrogen again, inhibin, and progesterone. So, what we see in the concentration levels of these ovarian hormones, estrogen will increase until ovulation and then drop slightly. Inhibin was not present until after ovulation. Then it begins to increase thanks to the corpus luteum. Progesterone levels were low until after ovulation during the luteal phase. So at 21 days of the female reproductive cycle, progesterone is increasing, inhibin is increased, and estrogen is still detectable. And all these hormones are all produced thanks to the corpus luteum. So what do these hormones do? Well, inhibin has a negative feedback and it will essentially inhibit the secretion of follicle stimulating hormone. Because we are at the luteal phase, we don't need any more follicles to mature just yet. So that is why inhibin is preventing follicle stimulating hormone release, prevent follicle maturation. So here I wrote, as the secondary corpus luteum develops, inhibin secretion will suppress follicle stimulating hormone release. Progesterone is the most important hormone in the luteal phase and has many functions, one of which is having a negative effect on the hypothalamus, inhibiting the secretion of gonadotropin releasing hormone. Now, after ovulation during the luteal phase, the progesterone levels will increase slowly and the estrogen levels will decrease slowly, kind of. And this will suppress gonadotropin releasing hormone release. And so progesterone will inhibit gonadotropin releasing hormone release, which will also affect the release of luteinizing hormone and follicular stimulating hormone. So during the luteal phase, as progesterone and inhibin increase, this will essentially cause a decrease in gonadotropin releasing hormone, luteinizing hormone, and follicular stimulating hormone. But the main effect of progesterone is that it will stimulate endometrial growth. The endometrial lining is the lining of the uterus, which will shed each month, or the endometrium is where the egg will implant if it's fertilized by sperm. Okay, let's just say there was no fertilization because this is just a normal menstrual cycle. And of course, all good things have to come to an end. The corpus luteum in the ovary will degenerate, um, allowing a new set of follicles to mature. So, as the corpus luteum degenerates, all these hormones that were produced by the corpus luteum, estrogen, inhibin, and progesterone, they will decrease like so. So when the corpus luteum degenerates, progesterone will decrease. And this will mean that progesterone cannot inhibit gonadotropin releasing hormone release. And so gonadotropin releasing hormone levels will increase. And this will allow a new menstrual cycle to occur. Also, because of the decrease in progesterone and estrogen in part, means that these hormones cannot maintain the endometrial lining in the uterus. And so the endometrium will shed, and this is known as the period. And after the endometrial lining sheds, this allows a new cycle to occur, and then you see increase in gonadotropin releasing hormone again, and the cycle continues. Hope you enjoyed this video. Thank you.
Okay. So, that's it. Parang, hindi mo siguro doktor yung nag-present sa atin. So, what realization did you get? Both from the discussion sa ating module and then doon sa video na ating pinanood. Realization po. Naniniwala na kayo ng hormone. Hypothalamus. Going back, coming from the brain, the secretion of these hormones originates from the brain, yung hypothalamus na tagal na natin hindi na didinig, no? Lalo na kung kayo ay ABM, I don't know kung meron pa kayong subject na nagdi-discuss nito. Yung nasa junior high school kayo, meron din ba? Maliban na lamang kung ganun ka busisi, nagpaliwanag sa atin. Saan nyo ba na-tackle ang reproductive organs? Are you with me? Grade 5 pa? Grade 10. Good for you. But, pinaliwanag ba sa inyo na the human life is affected or influenced by hormonal changes, hormones production? May realization ba kayo after that presentation? It's not about the physical characteristics of our human body alone, but the deeper understanding of how nature takes place inside our body and how the systems are connected. Pag human brain ang involved and how it works, anong tawag doon? Tama ba siya sa central nervous system? Kasama po ba sa central nervous system ang brain? Ang hypothalamus? Ayan. Yung even the depression, meron yung depression, yung psychological depression, ganyan. Hormonal din. So, understanding all of these concepts na hormones. Ngayon, ang trend ng tao, aside from the gender and society na kailangan maintindihan yung human nature, para pag nag-a-assign kayo ng role doon, nag-a-assign ang society ng role sa babae at sa lalaki, meron mga considerations na tinitingnan. So, yung palang cycle, nagsisimula sa unang araw ng menstruation. Are you aware? Samantalang, ang understanding natin, yung mababaw na pangunawa natin, ang ending ng cycle ay yung pagre-release ng mens. Tama po. Sabi nga niya kanina, everything must come to an end. Parang yung flow ng discussion niya. Hindi diba? Di ba? Sa presentation, yung ending is nag-mens. If it cannot hold on, no? Kumbaga, doon sa matured egg cell, the endometrium cannot contain, diba? So, it will fall as a menstruation. Pero pag inanalyze ninyo, yung phase 1, day 1 niya is release of menstruation. Cycle nga eh. Cyclical. Other thing than that, the 14th day of the cycle is dangerous. Understanding the human body. If you think that that is safe, sabi nila safe yun eh. 2 weeks ba? Or 7 days after menstruation? Or the 7 days after the first day of menstruation is safe. Hello? May taghabol pa kaya? Yak. Yak, hindi dahi-dahi, diba? Parang ganon. So, minsan, pag hindi mo inaral yan, tapos you are engaging into active sexual activities, posibleng unplanned yung magiging pregnancy mo. So, it pays na alam mo para handa ka din. Ganyan. So, ano ang kinalaman nito sa society? So, lahat tayo nagsimula bilang regla. Hindi pala. Frustrated na regla. Simula tayo sa ganun. Yung release of hormones inside the female body is responsible for the creation of human being. So understanding this concept allows us that there is a natural process involved in the reproduction process or inside our reproductive system. Sex is not just about having your genitals as parang vagina or penis. Sex, no? Understanding sex itself in the perspective of gender and society, no? Uh, a female individual has her special characteristics. Cycle happens inside her body, also in the men's body, no? And may malalim na pinanggagalingan yung kahit na pinakamaliit na cell na pinagsisimulan ng tao, we might as well give credit to that nature inside a human female body. Na simula doon sa konseptong ito, maunawaan natin kung ano ang kakanyahan ng isang babae. How beautiful the both men and women, no? And their nature. So doon pa lang magrespeto na tayo. No? Irespeto natin ang mga kababaihan kasi meron siyang special characteristics na hindi ka pareho ng lalaki. This explanation should open your mind to respect and parang admiration of the human nature. Hindi niyo siya tinitingnan yung genitals as parang nakakabastos or what. So, di ba pinakita sa atin una yung hypothalamus, the brain aspect in the human development. And the next is pinakita naman sa atin yung shape ng female reproductive organ inside. Then, sa uterus, ovary, fallopian, inside iyon. Tapos, in-specialize yung isang ovary, for example. So, pareho lang naman yung dalawang ovary. So, isa lang yung hinaitan, kumbaga. So, what happens inside the ovary? It tells us a story, a content that will appreciate the human nature, the female characteristics, special. Di ba? Isang topic tungkol sa regla. Paano nangyayari ang regla? gaano kahalaga ang hindi magkaroon ng regla at pagkakaroon din ng regla sa ating society. Menstruation in a different perspective. How is that? Miss Christine Penyola, what is your self-reflection?
Hello, rinig na po.
Yun na.
So, dun po sa base sa lesson po ngayon, nalaman po natin na kaya po pala nagkakaroon ng menstruation is wala pong dahil walang union na nangyari dun po sa ano part yun? Sa uterus po ng girl. Dun po.
There was no union kaya
Apo.
nagkakaroon ng regla. O kaya hindi nagkakaroon ng regla kapag all other things constant, nagkaroon ng union, yung sperm at saka ano, hindi na nga natin masasabing through sexual intercourse, di ba? Kasi meron ng mga artificial insemination nowadays na doon na nila biniblend o minimix yung sperm cell at saka yung egg cell. So, yung discussion pwede pa lang, basta may union tapos inimplant doon sa uterus, not necessarily having a sexual intercourse. No? Tama po, Miss Christine? Pag hindi nagkaroon ng sexual intercourse, magiging regla. Tapos, kapag positive yung naging union, hindi na magkakaroon ng regla. Regla sa buhay ng tao, sa buhay, sa society. Paano siya nakaka-apekto. Yung pagdami ng populasyon is maraming failure na regla or menstruation. Yung pagdami ng population is attributed to failed menstruation. Mr. Jimwell, as a male student, how would you assess? Did you listen? Were you interested? Okay lang naman kung hindi.
Yes, narinig po.
What was your impression?
Nakaka-intrigue po yung kung paano po nagwo-work yung female human body. Kung paano po siya nag-send ng signal na stop na yung ovary sa pag-send sa paglabas ng egg cell kasi meron ng fertilized egg cell. Nakaka-intrigue po kung paano po siya nangyayari.
Of course, we're not scientists, no? Hindi tayo mga scientists or medical practitioners for us to understand fully yung cycle na yun. But it should be known, no, to many. Kasi hindi naman highly technical yung pagkaka-approach niya eh. Yun lang, may introduction of different hormones, luteal, follicles, gano'n, ano. Pero, pagka nagka-problema na kasi, pag nagka-problema na yung FSH na yan, nakakakita ako ng abnormalities, no, na nagre-resolve sa mga illnesses, doon lang tayo ini-introduce, doon lamang tayo pinapaliwanagan, nag-occur na pala yung mga abnormalities na yun at gamutan na kaagad ang susunod. So, thank you again for having with me. No stress afternoon. So, good luck sa susunod na subject. I know may susunod kayong subject. So, I'm ending this meet and I hope that you learned. If you still want to master, to understand fully, andyan po yung material. Pwede niyo pong i-browse again.